வணக்கம் மக்களே, let's get started. Today we are going to see about tumor suppressor gene. I hope you have seen this table in Robin's book. It is such an important table. You have to memorize everything from this table. It is very important. Today we are going to see what is TP53, how does it works, and mutation causes what. TP53 mutation causes what, and this is table number 7.7. We are going to discuss about TP53 gene. As we already known, it is a tumor suppressor gene. It regulates cell cycle proliferation, cellular senescence, apoptosis, and DNA damage and repair. So it is located on chromosome number 17q13:1, and if there is any loss of function mutation, it leads to carcinomas like carcinoma of lung and carcinoma of breast and carcinoma of colon. Okay, as there are two alleles, if one is normal, one allele is normal and another one is mutated, it leads to a syndrome. It leads to a syndrome called Lee-Fromenis syndrome. It leads to many carcinoma. It is most common in many carcinomas like sarcoma, breast carcinomas, leukemias, and so on. Okay, next chromosome TP53 is a gene which encodes a protein called P53 protein. Okay, it is a negative regulator protein. Okay, now consider this gene as P53 protein and this magic lamp as MDM2 protein. Okay, so gene will prevent carcinoma in humans. So always MDM2 keep check on P53. I mean, it degrades P53. So actually when there is ATM gene, ataxia telangiectasia mutation and ATR gene, it leads to P53 accumulation. Okay, accumulation. So it leads to cell repair, and if can't repair, it even lead to apoptosis. So it's very important. What I mean is MDM2 is always bind with P53 gene, and if any cell damage or hypoxia has occurred, it leads to ATMR or any mutation. It is most common. These mutations are most common in ataxia telangiectasia, and it leads to P53 accumulation. It is a negative regulator protein, so it helps in cell repair and apoptosis. Okay. Next, if there is any oncogenic stress, it leads to increased expression of P14 or ARF, and these are encoded by CDKN2A tumor suppressor gene. So it binds with MDM2 and displaces P53 from MDM2. It leads to increased P53. So it also helps in cell cycle arrest and apoptosis. Next one is P53 induced senescence. It is a permanent cell cycle arrest. It is senescent, permanent. Specific changes in morphology and gene expression. And P53 induced apoptosis. If there is loss of P53, then there is no check in cell cycle division. So cell may undergo uncontrollable division, which leads to malignant transformation. So if there is loss of P53, it may lead to malignant transformation. And there is another viral protein. E6 protein is a protein of HPV. It can inactivate P53. It is also, if inactivation means loss of function in P53, so it can also lead to malignant transformation. Okay, next, transient P53 induced cell cycle arrest. Primordial response to DNA. This is what happened when DNA damage occurs. There will be a cell cycle arrest transiently. If the DNA damage has corrected, then the cell cycle will continue. If not, it will end in apoptosis. So there is a G1 phase, P53 dependent transcription of CDKN1A gene. So there is a CDK inhibitor P21 which inhibit the cyclin. So maintain RB in hypo. Hypo mean what? Hypo means it is in an active state. It is a guardian angel. So it won't allow the cell to enter into a cell cycle. So block the progression of cell from G1 to S phase. So this is what happened. Actually P53 is a checkpoint, is a protein acting on G1 phase. Okay, in G1 phase it produces CDK inhibitor, it blocks cyclin complex and it maintain a RB in an active state, that is in hypo state, and it leads to block the progression of cells from G1 to S phase. So it leads to, if there is a block, this is called breathing time. This is the time where DNA damage gets repaired. So GADD45, this is growth arrest and DNA damage. DNA damage will be repaired here. So after it is repaired, P53 will fall. Then it leads to release the cell block and the cell will undergo cell division. That's it. Thank you.